We've got a lot to get to, including this tug of war over who really does have the authority to reopen the country for business when this pandemic crisis has passed.
As we begin this morning, the U.S. now has more than 583,000 cases of the coronavirus, including nearly 24,000 deaths.
That number includes the first reported fatality in the state of Wyoming. It means all 50 states have now recorded at least one coronavirus-related death.
Meantime, there are new signs of hope here in New York, where deaths and hospitalizations have flattened. Governor Andrew Cuomo saying the worst is likely over if people continue to be smart when it comes to safety precautions.
The governor's going to be our live guest just ahead, but let's start our coverage with NBC's White House correspondent Peter Alexander. Peter, good morning to you.
Hey, Savannah, good morning to you. President Trump has repeatedly put the ball in the governor's court, saying that they're the ones responsible for combating the coronavirus crisis in their states. But now he is reversing course, saying as they make their own plans to reopen, actually, he is the one calling the shots. Just one of the president's extraordinary comments from a heated briefing that focused less on the deadly pandemic and more on his handling of it.
President Trump now declaring that he is the sole power who gets to determine when and how states reopen, even as governors in some of the hardest hit states make plans of their own.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be. And the governors know that.
In fact, the Constitution gives that power to the states. And experts say the president does not have the authority to direct governors, mayors, or other local officials to lift their emergency orders. Overnight, New York Governor Andrew Cuomo challenging the president's claim.
To say I have total authority over the country because I'm the president, it's absolute. That is a king. We didn't have a king.
The tension punctuating a White House briefing where President Trump was combative and at times angry.
I haven't asked anybody because I don't. You know why? Because I don't have to.
But who told you the president has the total authority?
Enough.
The president also playing a White House-produced campaign-style video in an effort to defend his handling of the crisis that's come under increased scrutiny.
Everything we did was right.
President Trump highlighting his January ban on travel from China.
One case in the whole United States, one case. I'm supposed to shut down the government, the biggest economy in the history of the world. Shut it down. We have one case.
And sparring with reporters who challenged the federal response beyond that January ban.
January 30th.
What did your administration do in February with the time that your travel ban bought you?
A lot. And in fact, we'll give you a list. What we did, in fact, part of it was up there. We did a lot. Look. You know you're a fake.
Over the weekend, Dr. Anthony Fauci argued more lives could have been saved here if the government acted sooner.
I mean, obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
On Monday, the president calling Fauci to the podium, where the nation's top infectious disease doctor clarified his comments about pushback within the administration.
And that was the wrong choice of words.
A day after retweeting a post that included the hashtag #FireFauci, the president praising the doctor.
Today I walk in, I hear I'm going to fire him. I'm not firing him. I think he's a wonderful guy.
Today, the president is scheduled to meet here with people who have recovered from COVID-19. And as for the economy, he says when it reopens, in his words, I think we're going to boom. But many of his allies and economists agree no matter what President Trump says, the real recovery will not happen until Americans begin feeling safe returning to their own lives. Savannah and Hoda.
Peter Alexander leading us off at the White House. Thank you, Peter.
Amid that battle over when and how to reopen parts of the economy comes encouraging new signs that the coronavirus curve is flattening here in the nation's epicenter of the outbreak. NBC's Gabe Gutierrez joins us from a very empty Times Square. Hey, Gabe. Morning.
Hoda, good morning. It's been more than 3 weeks since the governor issued his stay-at-home order here, and Times Square has been eerily quiet since then. Now, governors from multiple states are banding together to decide how best to gradually reopen the economy here. The death toll has now topped 10,000 in New York State, but ICU admissions and intubations are way down. The clearest sign yet, the curve is flattening.
The worst can be over, and it is over, unless we do something reckless.
Now, the governors of New York and 6 other northeastern states that represent more than half of the nation's coronavirus cases are partnering to discuss the best way to safely ease restrictions and restart the region's economy. The group of governors includes 6 Democrats and 1 Republican.
We cannot act on our own. Even if we give ourselves an A+, that won't be enough. This is incredibly important that we coordinate.
3 Western states, including California, are doing the same. In New York City, 21 public school teachers have died from the virus. And COVID-19 is killing as many New Yorkers in 3 days as the seasonal flu typically does in an entire year. But there are some encouraging signs. The number of newly hospitalized patients in New York is at its lowest point in weeks, but that doesn't mean doctors and nurses aren't still stressed.
Every patient is getting multiple medications. Some are getting blood transfusions.
Dr. Melanie Malloy works at Mount Sinai in Brooklyn.
It's hard to think that some of your patients that you diagnosed today might not be here tomorrow when you come back for your shift, or, you know, all of it. I don't know. I'm just tired.
Ariana Dumas is an ICU nurse at North Shore University Hospital who brings iPads to her sickest patients to help them connect with their loved ones.
Just holding his hand, playing the video, and crying. That's like kind of the perfect scene of what it looks like when we're in there with these patients.
Now, to be clear, we do not yet know when all of this might reopen, but Governor Cuomo says that the multi-state group of governors might begin working on the plans as early as today. Savannah?
All right, Gabe, thank you so much. And again, Governor Andrew Cuomo of New York will join us live in just a moment. But first, as elected officials grapple with how and when to restart this economy, what exactly could it look like? Neel Kashkari is the president of the Federal Reserve Bank of Minneapolis. He helped run the bailout program at the Treasury Department during the 2008 Great Recession. Mr. Kashkari, good morning to you. It's good to see you.
Good morning. Good to see you as well.
You said on a Sunday show this weekend that you look at this kind of on an 18-month timeline, that you think that economic strategy should really be over 18 months because that's the outside estimate of when we could get a vaccine. What exactly does that mean? Because I'm sure a lot of people are thinking 18 months. I can't sustain this for 18 months.
I understand. But when we look around the world, other countries that have successfully flattened the curve with economic controls, it seems as though when they relax the controls, there's a tendency for these flare-ups to happen again because so many people have the disease, but they're not showing symptoms. And so until you really extinguish it with either a treatment or a vaccine, there's always that risk of flare-up. And so we have to be very careful and think over the long term. To me, it's not about the next couple of weeks or the next month even. It's about how do we get to that destination of a vaccine or a therapy.
But to be clear, I mean, you're not suggesting that everybody stay at home and businesses stay essentially as they are for the next 18 months, or are you?
Well, not as they are, but I think we need to be very smart about this. So I'll give you an example. Some businesses are much more important than others. Think about optometrists are largely closed. I could see if we flatten the curve, optometry offices opening so you can go get your eyes checked. There are not a lot of people crowded into an eye store at a given time. Contrast that with a movie theater. Is it going to make sense to have 100 people in a crowded movie theater until we have a vaccine? Probably not. I don't think we're going to go back to the way life was like in January or February for the next year or next 18 months. I think we're going to have to be much more targeted as we try to reopen the economy.
What do you think? I know you're in the economic sector, not the public health sector, but from your analysis, what do you think needs to happen before you can start talking about letting people go back to society, even if it is in a piecemeal fashion? For example, do we have to have widespread antibody tests, a blood test that would tell you if you've had the virus and if you are presumptively immune?
Well, I think that would be great, and we should be pursuing all of those widespread testing as well as vaccines and therapies. But I've also talked to health experts who think that we are months, if not years away from being able to test millions of people on a given day. So I don't know where the breakthrough is going to come from. I think the governors are being very smart in trying to flatten the curve, but we're going to have to slowly reopen things and then very carefully see if we're getting flare-ups again. We might be in a case of relaxing things, it flares back up, we have to lock things down again and keep doing that for the foreseeable future until we get an effective treatment or a vaccine.
You know, the Federal Reserve Chairman Jerome Powell was on this show recently, and he talked about how prior to this crisis, you know, the economy was in fundamentally a strong position, this long expansion after the Great Recession, uninterrupted job growth. And so the notion was once this public health crisis passes, we should be able to return to a strong economy. Do you believe that to be the case?
I think that's true. But again, if this reopening, I wish it were just a light switch. If there was some therapy that emerged a couple months from now and we all had confidence we could go back to work and not be taking risks, then we could turn things around very quickly. But I think the more that the health experts are learning and learning from what's happening around the world, it seems as though it's going to be more of a gradual return to normal. And the more gradual it is, unfortunately, the slower recovery and the longer it takes to get back to normal.
And it's kind of a deeper question, philosophical question, but it's an economic one too. You know, what has changed fundamentally that may not ever go back to be the same? I think about small businesses in my neighborhood. I wonder if they'll be back no matter how much help the government gives them. I wonder if people are going to want to go to big sporting events. I wonder if businesses are going to say, yeah, we should have a convention. Have you thought about how this economy may have changed forever just by virtue of this experience?
Absolutely. And what you're saying is exactly right. We know after the Great Depression, people carried the scars with that experience with them for many, many years. Ultimately, who's going to determine how the economy recovers? It's all of us. It's how comfortable we are having our families going to that restaurant or going to the movie theater or going to that sporting event. And I think the longer this goes on and the more people that are affected by it, the longer that recovery is going to be, just because we have to regain confidence ourselves.
We do indeed. Minneapolis Federal Reserve Bank President Neel Kashkari, thank you for your work. We appreciate it and your time this morning.
Thank you.
We're going to have a lot more on the pandemic just ahead. And again, we want to remind everybody, Hoda and I will be together tonight anchoring our primetime NBC News special, bringing you the very latest, answering your questions, and also a lot of stories about what's being innovative right now and how people are handling this crisis. You can find it on NBC, on MSNBC, and also streaming. We're going to get more on those storms and also today's forecast. Hello, Al Roker.
Al.
Good morning, sunshine.
Hey guys, good morning. Good to see you. And thankfully, our weather is a little quieter today than it was yesterday. My gosh. But as we look, we can see that the remnants of that system now has pushed into the south, making its way through northern Florida, where we've got some strong storms firing up. This front stalls from Florida to the Carolina coast. We're looking at some localized heavy flooding tomorrow. Showers and storms will continue all day. And we're also looking at heavy rain, upwards of 4 inches or more, northern Florida into southern Georgia. And here in the northeast, we're looking at this upper level impulse from the Great Lakes. It's a developing storm that'll bring rain and wet snow into the northeast, clearing skies and cool temperatures later in the day on Thursday, much cooler than usual for mid-April.